So what do we need in doing the long arm posterior mold? First, we'll be using plaster of Paris for casting, stockinette, which is in contact with the skin to lessen irritation, wadding sheet or soft roll, which serves as the padding, scissors, basin and water, elastic bandage to secure the splint, and arm sling. The patient should be seated and use the uninjured arm to support the injured arm as shown here. The elbow and the wrist should be kept close as possible to the side farnal position. Typically, this is 90 degrees of elbow flexion with neutral pronation and supination. Measure stockinette from palmar crease to mid-humerus. Roll the stockinette onto the arm to the axilla, avoiding bunching, which could irritate the underlying skin after the plaster is applied. Remember to keep the elbow bent at 90 degrees. Trim hold for thumb. Thumb should move freely. Wrap 1 to 2 layers of padding or wadding sheet or soft roll, overlapping by about 50%. This procedure decreases risk of pressure ulcer formation. Pad elbow and wrist with extra soft roll. Avoid excessive soft roll anteriorly in the elbow crease. Next, we will use another wadding sheet for making the template for the plaster of Paris cast. The length should be 2 inches shorter than the stockinette. Cut, then add approximately 3 more side by side, overlapping each other. Then add another in the middle. Then I fold it backwards. Don't cut it. Fold it backwards. This will be the layer for the other side of the splint. Then we'll use the plaster of Paris for the splint. For the upper extremity, ideally it should be 10 to 12 layers, but for the lower extremity, 12 to 15 layers. Soak the plaster of Paris in water. Make sure the water is lukewarm or at room temperature, ideally 23 to 25 degrees Celsius. Because if the water is too hot, then the cast will set faster. If too cold, it will set a slower rate. Submerge the cast in water till there are no more bubbles seen when cast is gently squeezed. This means that the water have seeped through the spaces. Remove the excess water gently by squeezing it. Lay it on the middle of the template, then smooth it out a little bit so that there will be no more air pockets, because those air pockets will weaken the mold. Now, apply the mold along the posterior aspect of the arm and ulnar aspect of the forearm. Fold over any excess plaster to ensure it does not overhang the wadding sheet. Ask your assistant to hold the mold for you while you apply the elastic bandage. But in my case, I don't have one, so I'll ask the patient to hold it for me. Remember to preserve the 90-degree elbow flexion. Apply the elastic bandage twice. The first application should be a bit tight, but not very tight, and you start distally. A bit tight for the splint to mold and follow the contour of the limb. Later on, if this has set already, we will adjust the tightness to loosen this a little bit. Then, mold the splint a little bit. Use the ball of the hand to mold it to follow the contour. Usually, plaster of Paris sets within 10 minutes. You can advise the patient that he or she may feel some warmth because of the exothermic reaction from the cast. After 10 minutes, you can now readjust the elastic bandage. Fold the excess stockinette to cover the edges of the splint. Then reapply the elastic bandage. Remember to also preserve palmar flexion. When reapplying the elastic bandage, it should be a little bit loose. You may also ask the patient if it's too tight. You can secure it with the clips or with the micropore tape. Ask the patient if he or she can move the fingers. Ideally, he or she must be able to move the fingers. Then, apply sling a 90-degree angle at elbow. Remember, this type of splinting is only temporary. If this is a radius ulnar fracture, this is not the definitive treatment. It's something you can do only in the acute setting in the ER to lessen the swelling, pain, or any other injuries in the area around the fracture.